Hello, welcome again to Miami Community Health and Live Longer with Dr. Anthony Gonzalez. Another important health topic. You know, if you want to live longer, you need to have a good heart. And you know, we are entering Heart Month, Heart Awareness Month. The American Heart Association wants to bring awareness because we need to bring awareness to our community. We need to talk about prevention of heart disease. We have to understand the risk factors associated with heart disease because heart disease is the #1 killer in the U.S. And so if you want to live longer, you got to take care of your heart. Now, when should you start taking care of your heart? What I've learned recently that you got to take care of your heart even if you're a baby. And if you're a newborn, you know that heart disease and heart conditions occur in 1 out of every 100 newborns? I didn't realize it was that common. So to start off Heart Month and Heart Awareness Month, we've brought a pediatric cardiologist, electrophysiologist. That's a lot of words. We're going to learn a lot about those words. But we brought a pediatric heart doctor from Nicklaus Children's to talk to us about hearts. Hearts in newborns, hearts in kids, hearts in babies. So welcome. Welcome, Joy.
Thank you very much. Thank you for having me.
All right. So pediatric cardiologist, I guess we can understand that, pediatric heart doctor, electrophysiologist. So tell us a little bit about you and what you do.
Sure. As you said, I'm one of the pediatric electrophysiologists. Basically, a pediatric electrophysiologist is a specific type of pediatric cardiologist. Pediatric cardiologists take care of kids with congenital heart disease, heart defects that are present at birth. But there are two major parts of the heart that can go wrong. There's the structure of the heart, the anatomy of the heart. You know, you have chambers of the heart, you have veins and arteries, you have valves. But then there's the electrical part of the heart, and I'm obviously biased. I think that's more interesting, right? Our heart beats automatically because there's a movement of an electrical signal coming from our normal pacemaker, which is in our right upper chamber, and then goes through, I guess, what you can think of as electrical cables through the heart to the lower chambers, which are your pumping chambers, and that's what makes your heart beat. And so my expertise as an electrophysiologist is basically rhythm problems of the heart or heartbeat problems related to pediatrics or to children.
Wow. And I didn't realize, I mean, of course, in adults, we know about all the arrhythmias, atrial fibrillation, and all these other things. But I didn't realize how common is overall any type of heart condition. And is it really 1 in 100 like I've read? And what, you know, structural more of the electrical? Tell us about some of the statistics around this.
Sure. As you said, it does affect 1 in 100 of kids. About 40,000 live births in the United States. But that's most of the time it's a structural thing. And that includes things like simple heart disease, where you maybe have a hole in your heart. And sometimes people can live their lives with that, you know, depending on how small the hole is. Some holes will close on their own, for example, and they're able to live their lives normally. There's more complex congenital heart disease where you need surgery as a baby, even as a newborn. And then there's very complex stuff where you might need something, different types of procedures throughout your life. From an electrophysiology standpoint, arrhythmias are less common. About 24 or so in 100,000 births. In kids, though, less than 15, it can be as high as 25% heart arrhythmias or abnormal heart rhythms. But a lot of those things are actually things that we don't really it doesn't affect your life. And so, you know, we say, hey, you have this, but don't worry about it. Go live your life. You don't need to see a cardiologist anymore. And then there's other things that I see that are less common, but then those kinds of things actually affect their lives, and there's procedures that we can do to help them with that.
All right. So at Nicklaus, we take care of all kids' heart problems. So talk to us about that. My own little, I guess, my cousin's child, who's now maybe 6-8 years old, had open heart surgery. And I remember when he was born there, he was a twin, and it was scary. And they operated on him as a newborn. And I used to go visit him there in that little ICU. So obviously you guys do open heart surgery on little babies and newborns. So talk to us about some of the programs. So obviously you're involved in electrophysiology points.
Yeah, so I mean we have a number of cardiologists. You know, we have the general cardiologists who just are in charge of diagnosing the heart disease and then watching them and following them after surgery. We also have interventional cardiologists who will go in with catheters and, you know, open up a valve if a valve is closed or stenotic or narrow. And then we also obviously have the cardiothoracic team who are the ones that do the open heart surgeries, because there are some kids that at birth have issues, and they actually need to go to the OR right away. And so it's a whole team that's taking care of the children with heart disease.
All right, so let's focus a little bit more on your portion as an electrophysiologist. How does somebody know, the baby is born? We're not doing EKGs and all those babies, I would imagine, right? So how do they know that there's maybe an electrical problem with the baby, and how does that get worked up?
From an electrical standpoint, sometimes you can actually have those arrhythmias in fetal life. And so it's very important when you're pregnant to go to your OB appointments and do make sure that you keep up with your prenatal care, because they're the ones that will see you on a regular basis, and they will be the ones that you might see something on the ultrasound or in the vital signs, and they will say, hey, I think you need to see a fetal cardiologist. I'm not a fetal cardiologist, but we do have fetal cardiologists on our team that would be able to then see those patients. Sometimes they're sent to the fetal cardiologist just for screening, let's say for high-risk pregnancies, for example, for IVF babies or twin pregnancies, or if the mother has diabetes, or if there's a family history of complex congenital heart disease, or they see something on the ultrasound like an arrhythmia, or the baby is not growing properly, and you might see a fetal cardiologist from that standpoint. And then if it is an arrhythmia problem, which they will see on the fetal ultrasound, they will then call us as electrophysiologists.
And how do you pick up an arrhythmia on a fetal ultrasound? Just by the beats? Because you're not doing an EKG on the
Correct.
fetus.
Exactly. So because you're going to see on the ultrasound that it's beating abnormally.
Oh, right. So then talk to me about the newborns. So what happens with a newborn if they notice something? How do they notice it in a newborn? Is it the newborn having cyanosis? Are they blue? Or how do you pick up that there's a problem?
From a rhythm standpoint, usually it's not a blue issue. It's really they're not doing well, and then when they catch you, they have to do their initial evaluation, and if that patient is not progressing well, they'll check the heart rate. It's usually a heart rate issue, because when you're born with an arrhythmia, the most common arrhythmia in kids is called supraventricular tachycardia, and that's when in a baby your heart rate could be 250 beats per minute, close to 300 beats per minute. They're going to notice that when they do their initial assessment.
Okay. And so a baby is born, the normal heart rate is what on a baby born?
It's higher than us.
No, of course. Yeah.
It's about 150, maybe 160.
Okay. And so if they see the supraventricular tachycardia, they call somebody like you to get involved. And so let's talk about that. How is that? What is the evaluation of that, and what is the treatment for that?
So the treatment generally for run-of-the-mill supraventricular tachycardia, which is usually the case, you can give them medicine to make it stop. If they're unstable, then you would actually need a shock, an electrical shock to get them out of that. Most of the time that's not needed. And you can just stop it with a medication that works just for a fraction of a second. And then after that, when the patient is stable, then you do your evaluation of the whole heart, because sometimes arrhythmias occur actually because there's something structurally going on. So they could be going together. And so you would need an ultrasound of the heart, an echocardiogram, a complete echocardiogram, to make sure that the structure of the heart is normal. Sometimes if they've been in an arrhythmia as a fetus, when they come out, the heart function might be down because it's been working hard for that long period of time. So you would check the function of the heart. And then, because they're babies, we would basically deal with them medically with antiarrhythmics, medications that control the heart rhythm. They usually do very well with that. Most kids that are born with an arrhythmia actually have a structurally normal heart. They're sent home on a medication or two, and then we wait and see about 90% or 75 to 90% of those that have an arrhythmia at birth, they will self-resolve by the age of 1 or 2. And so the medications may not be forever. If, on the other hand, it doesn't go away, then there are procedures that we would do to actually cure it.
Wow, that's great to hear. And so are the procedures similar to what we do in adults, like these ablations and so forth?
Exactly.
So explain to the audience what an ablation is.
An ablation is basically we put catheters, which are like long plastic things, into the veins of the leg, and we go into the heart with those catheters. And the technology is fascinating for me, once again, because I'm an electrophysiologist, so that we're able to go into the heart and make a 3D image of the heart chambers without having to step on fluoroscopy or x-ray. Yes.
Oh,
And so the
wow.
catheters have kind of a GPS type of technology where it sees the electrical signals, and then based on the electrical signals, it will make a shell of the heart or make a 3D image of the heart for us. And then with those same catheters, we would actually pace the heart in a certain way and make you go into the abnormal heart rhythm. Everything is controlled, right? In the same way that I put you in an abnormal heart rhythm, I can take you out with pacing in a certain way with those catheters. But basically, we put you in the abnormal heart rhythm so that we can map, we can find where the abnormality is coming from. Most arrhythmias in kids are due to an extra electrical wire. Right, I told you that my expertise is in the electrical wiring of the heart. There's an electrical wire that's extra, and so it goes down the normal wire and then turns around at that abnormal wire, and that's what causes you to have a heart rate of 200 beats per minute. And you just find that area, that extra wire, and you cauterize it. That's what ablation is. Wow. And we get rid of that, and then we can say, hey, it's gone, don't worry about it, you can live forever.
And they can live normal lives.
Yes, exactly.
Play sports and do all types of activity.
Exactly.
That is different than the way they do it in adults, right?
Yeah, so because of the type of arrhythmias we generally deal with, which is more the extra wires, our success rates and the chances of recurrence are much less. The type of arrhythmias that older individuals deal with has to do with the stiffness of the heart. It just comes with age, and so for those things, the recurrence rates are higher because it's not just one area, and things can kind of grow back, or you can get different circuits that are abnormal. But in a patient that has SVT, which is generally what we deal with, it's one extra wire, and we just deal with that.
Wow. So we talked about a newborn being born and they're diagnosed with a supraventricular tachycardia, very high heart rate. But what about the normal baby that's born? Mom takes the baby home. Mm-hmm. What should mom be looking for to be worried that maybe my child has a heart problem or there's something wrong? Obviously, mom may not be able to make the heart problem diagnosis, right? But what are the warning signs for parents, Here, our audience today are parents, grandparents, caretakers of these kids, of these babies, of these children, and these young adults that you guys take care of. What are some of the warning signs?
What I would tell them is basically the same things that would make you get professional help, to go to the doctor or go to the emergency room, are basically the same things. So a baby doesn't really exercise, but its way of exercise is feeding and growing. So if a baby is not taking the bottle well, it's sweating a lot when they feed, not growing very well, those are warning signs that maybe something is going on. It could be something else, but it can also be the heart. Certainly if your baby is turning blue at home, then that would be something to go to the emergency room for as well. But those are the things of just not feeding well, not growing well. Those may be signs that there is a structural issue with the heart, like maybe there's a big hole in the heart that's making it difficult for them because the heart is working harder. In the case of arrhythmias, that may also be the case. A baby's not able to tell you, hey, my heart is beating really, really fast.
Right, yeah.
But they start to do not feed well. They are cranky for some reason. They're crying all the time. But those are some things that you would go to the doctor for anyway, or go to the emergency room for anyway, and then the doctors will decide based on what they see and their evaluation. Is it the heart? Could it be the heart? Could it be something else?
And can we see this also in like youngsters and little toddlers, or in little kids, or even teenagers?
Yeah, absolutely. From a structural heart disease standpoint, I would say the possible symptoms for heart disease are, chest pain, fainting. Chest pain is very common in teenagers, for example. It's usually like a muscular thing and it's not something serious. People faint when they see blood. That's a reflex. That's usually not a serious thing. But I would say the red flags as far as older children and adolescents is if you have symptoms of chest pain, when you exercise, you have to stop exercising because, you have chest pain or chest pressure. If you faint in the middle of exercise, please go see somebody. If you faint without warning, sometimes, when we get up from a chair, our blood pressure falls a little bit, we get a little bit lightheaded. Some people might faint from that. That's usually nothing serious. But if you're just walking around and all of a sudden you faint with no warning signs whatsoever, that might be something to talk to somebody about. And then also for the older children, they should be able to tell you, or they will be able to tell you, hey, I'm just sitting there watching TV everything is good, and all of a sudden my heart is racing like a racehorse, as if I'm
And
running.
I'm not watching a horror movie.
Correct, exactly. And so those are some of the warning signs that maybe something might be going on with the heart, and to make an appointment with your doctor, get a referral to the cardiologist, and then we can do the non-invasive testing like an ultrasound of the heart, an EKG, perhaps a Holter monitor, depending on what kind of symptoms you're having.
Now, obviously, we're talking about heart health, and when we're talking about, let's say, youngsters, young kids, and adolescents, what we know in the adults, nutrition and exercise very important. Have you seen, because of what's happened in our world with social media, with computers, with TVs, with supersized meals, is that impacting heart health in these youngsters?
Yeah, absolutely. I think that we shouldn't diminish the importance of lifestyle as far as the heart health is concerned. There was a time, long time ago, when people with heart disease, structural heart disease, kids with structural heart disease, we told them, hey, don't exercise. It might actually be bad for your heart. And we've learned that we've actually created some little monsters who, because they're worried about the structural heart disease, they don't exercise. And then we've actually added comorbidities to their structural heart disease. Now we know for every child that comes to me for chest pain, whatever it is, I counsel them regarding the importance of the lifestyle habits that you build right now. So I would encourage parents, while you have your child with you, to start building those habits for them that they can take for the rest of their lives. Because, whether or not you eat well, you exercise, there are things that are happening in your body, in your heart, in other organ systems that you don't feel as a child, that you don't see as a child. They seem fine to you. But then when they're in their 20s, their 30s, they have diabetes, they have early heart attacks. We don't want that.
Yeah, no, obviously, I've always heard nutrition, of course, exercise, sleep. Kids need more sleep, right?
That's absolutely true. I have kids that they come in with I'm fainting all the time, or I feel like fainting, and I ask them questions about their eating habits. They're skipping breakfast all the time. How are they sleeping? They're sleeping at 3 a.m, waking up.
Yeah, because everybody's on the machine and on the.
So I say some of this is a stress on your body, and your body's telling you, hey, you're stressing me out. Take care of me a little bit better. So
yeah, I think at least I lived a much easier life. There wasn't those electronics. We didn't have a TV in my room. So there was nothing. You go to your room and that's it. It was you go to your room was almost punishment, right? Because there was nothing in your room.
Exactly.
All right. So talk to me about Project Adam. What is Project Adam?
Project Adam is a very important program at Nicklaus Children's Hospital. Sudden cardiac arrest in young people takes the lives of 7,000 to 10,000 young people. And it's been shown, there was a study that was done in 2,000 schools, that if there is a plan in place, a system in place for the school to respond to potential cardiac emergencies, the chances of survival are as high as 85%, as opposed to when there is not a system in place, it's only about 25%. And so to be able to empower the schools, that's what Project Adam is to empower the schools and the staff of the school to be prepared in case something happens. We never know if anything can happen. We can't be prepared for every eventuality. But if something were to happen, there is a team in place. The staff is trained to respond. So the staff is trained to use the defibrillator, the external defibrillators. Wow. The staff is trained to administer CPR while we wait for EMS to arrive. And so Nicklaus Children's, since the fall of 2022, has partnered with the Miami-Dade Public School System. And 18 months after initiation, we are 100% Project Adam certified for all of Miami-Dade Public School System. Wow. And to date, 8 out of 9 lives have been saved because of Project Adam.
Wow. And so is this only locally in South Florida, or is this a national program?
This is actually a national program. And we are here in South Florida, we've just recently expanded to Palm Beach, the school system for Palm Beach. So, if you're a parent and your school is not Project Adam certified, I would.
But you're talking about all the public schools. What about the private schools?
Correct. So,
do all the public schools have a medical professional in all the public schools? They have like a nurse or something?
I believe so, yes. We usually have a nurse in the public health school system. But for the Project Adam, it's actually the principal and some of the staff members. A lot of the coaching staff also are involved. Because that's when things might happen.
Right,
you've heard of patients. You've heard of kids. They're in the field or the court, and then something happens, and so they are trained to respond to that. And the defibrillator is in a place where basically somebody can get to it within minutes. And get that started.
So if your kids are in public school, you don't have to worry. 100% Miami-Dade County, they have Project Adam. Check if your private school is involved in Project Adam, and if not, contact Nicklaus Children's.
Exactly.
Right? That's what I'm
Exactly,
hearing. Awesome.
yes.
That's incredible. So what are some other the great things that are happening in the world of cardiology, child, pediatric heart at Nicklaus? Give me some of the new advances and innovation that you guys are doing to really, really help our community and our children.
Sure. I think we're always trying to find some minimally invasive ways to deal with structural heart disease. So I'm not an interventional cardiologist, but I do know that if we can deal with valve problems, for example, in the cath lab, in percutaneously, meaning we go into the veins instead of having open heart surgery and putting a valve in place. So we have that now for the pulmonary valve. We're using the Harmony valve for patients where their pulmonary valve is not working well because they were born with a structural heart disease that affects that valve. And so now we're able to. It used to be that they get the surgery as a baby, and then as a teenager, because of the valve not working well, they need a second surgery. But now we can fix their valve without having to do open heart surgery again. So those are some of the things. There's other valves in the works that hopefully will be helpful with other parts of the heart. As far as I'm concerned, from an electrophysiology standpoint, we're always trying to build on the technology that we have right now. I told you about our 3D technology.
It's incredible.
Where we're able to map the heart. We have catheters that are able to map the heart basically within minutes, because there's like 100 things that it's looking at the same time to be able to map the heart, so that when somebody's in an arrhythmia, we don't have to keep them in that for minutes at a time, and we can find where the abnormal wire is. We have catheters that allow us to ablate even in scarred tissue. So in congenital heart disease, when you have surgery as a young person, there's arrhythmias related to when you grow older from that, because of scar that forms because you've had surgery in your heart. And sometimes those arrhythmias are hard to deal with because the catheters that we have are not able to cauterize that deep into the tissue or through that scar. And now we have catheters that are being used and being improved upon to be able to put the power deeper into the tissue, so that we can deal with scar-related arrhythmias, which is something that we deal with as the heart disease patients are getting older. Because we have helped them with surgery and other things like that. That also means that we're finding things that are related to what they were born with, that now we have to deal with as well. But that's why I said, the team that we have is a multidisciplinary team that's able to help you through all stages of your life.
That's incredible. And what you've told me was that most of the time, all of these electrical problems resolve in the majority of the time. They live normal, healthy adult lives.
Exactly.
Right.
That's actually part of why I wanted to be an electrophysiologist. There are things that we can't fix in medicine, as you know, but there were a lot of things in electrophysiology where I can say, hey, this was something that was there. You were born with it, but we can take care of it, and then you can live your life.
Awesome. And the best thing is to see that kid, now an adult, come back and see you maybe as a teenager, come back and see you as a young adult, or send you their wedding picture. Imagine that.
Yes.
Wow, that's incredible. That's incredible. Well, thank you. Thank you for what you do. Thank you for taking care of our kids, our young adults, and here in our community, and for bringing awareness to heart disease in children. Obviously, when we think of children, we think of holes in the heart, but there's much more than that, and definitely it's important. It's important to be aware of what's available in our community for our children.
Yes, thank you so much for having me.
My pleasure. So remember, I always tell my audience to remember about heart health. Remember to take care of yourself, take care of your children. Exercise, correct eating, sleep is very important. Be aware. If your child is born, obviously, with a heart condition, the doctors will pick it up. But if you see something wrong, inability to eat or feed, or having trouble with sports, bring them to Nicklaus Children's, and they'll take care of your child. So on behalf of our pediatric cardiologist and Nicklaus Children's, Dr. Anthony Gonzalez with Miami Community Health, reminding you, live longer with Dr. Anthony Gonzalez.